Maine lawmakers right now are looking to make health care more affordable, but one proposal is getting significant pushback.
Maine hospitals are speaking out against a bill. Christian Harsa explains what that is and gives us arguments from both sides. Hey, Christian.
Hi, Brian and Bailey. This proposal will put a cap on how much Maine hospitals can charge their patients for the services they provide. Specifically, the cap would be 200% or twice what the Medicare rates are for those specific services. And this proposal has significant support from key Democratic leaders here at the State House. The idea of capping healthcare costs is not new. 7 other states have done so or have plans to implement said caps. And in 2024, the Maine Office of Affordable Healthcare determined that capping costs was an effective way to reduce healthcare costs in Maine. However, Maine's idea would be one of the most substantial caps, applying to all private insurance holders, is mandatory and applies to both in and outpatient services. That is part of the reason why Maine Health and Northern Light Health are pushing back against this proposal. The bill also lays out rules for insurance companies, rules the bill's sponsors say will ensure better coverage for Mainers and curb rising healthcare costs. Maine Health, however, estimates that the cap would cut $627 million from its revenue.
That is more than 8 times the operating margin that we made in FY26, and it's more than 8 times the operating margin that we're budgeting for in FY27. That is not sustainable.
Right now, the insurance companies and the big health systems sit in a room and they close the door and they decide what healthcare is going to cost in this state. And the Maine people are not in that room with them. And this bill puts Maine people in that room. And that's why I think this bill is so important.
Now, if this bill were to pass, Mainers may still see the same costs that they do right now, and that's because of 2 key exceptions to this bill. The first being that critical access hospitals would be exempt, as well as those hospitals that are in financial distress. Now, hospital advocates say that Maine's biggest and most advanced hospitals would be facing these caps. I'll have more on this story later at 6. In Augusta, Christian Harsa, News Center, Maine.